Now, but still, what can be done with these machines? Some beautiful things. I want to give you just one example of brain reading, so to speak, using this functional MRI technology. And so this is a work by Samir Zeki and his collaborators in University College London, where they tried to examine something very interesting. Maybe there was, something very interesting. They looked at the neural correlates of beauty. Is there some region or regions in the brain that are particularly active when you like a particular painting? So they used this machine that I just mentioned, and they really wanted to do the following, Kawabata and Zeki, in a very beautiful paper called Neural Correlates of Beauty. They wanted to ask, are the brain areas that are consistently active across subjects, all subjects, when they perceive a painting as beautiful? Or in all subjects, are there regions that are active when you think or when you feel that this is ugly? So in order to do that, they used the following procedure, experimental procedure. They took students from both sexes and a lot of controls. I'm not going to repeat, but you can read the paper itself. And they used 4 categories of paintings: abstract painting, still life, portraits, and landscapes. Many repetitions of different portraits, different still lifes, and so forth. And each of the students, the participants of this experiment, had to quantify their liking of the painting. So I can look at this and say, this is very beautiful. This is before going into the magnet, so just a psychological test. So this is very beautiful. I give it 10. My grading of this is 10. I look at this, Mona Lisa, I like it very much, maybe not 10, 8. This I don't like at all, 5. So I grade personally, each one of the students grade the different paintings, but many of them. So Samir Zeki and his team already knew a priori that this particular student liked this, doesn't like this, and so on. So he had it in advance. Then he put the patients into the magnet, and he was looking at the brains of these people using the magnet. So again, the magnet, and now you start to show the same paintings before, but now each painting is marked per student, that he likes this or doesn't like it, she likes it, doesn't like it, and so on. So one obvious thing, as I just mentioned before, that for a particular category, you will get different brain region active. So for example, if you look at the activity of the brain activity in the magnet, the functional MRI signal, what we call the bold signal, when you look at the brain of all people, when they see portrait, minus the activity of all other categories, because you take the difference between the activity of the brain seeing portrait minus the activity of the brain for all other categories, so portrait versus non-portrait, you see the particular region that is specialized in portraits. So you see these regions are active, face regions, for example, as we just showed before. You look at landscape versus everything that is not landscape, you see other regions in the brain. So this is not a surprise. So, as I said before, for all of us, when we look to a face, there is a particular region in all our brains. All the brain of all of us is active in this particular region here. And if you look at landscape, this is similar to us. So I can read your brain, looking at your brain, and seeing that this is active. I say, now you experience landscape. You dream about landscape. You image landscape. This I can do. So that's not surprising. One interesting point I want to emphasize here is this one, is that when you do abstract, so you took an abstract painting and you show an abstract painting to the student or to you, and I look at abstract versus non-abstract, I see there is no particular region in your brain that deals with abstract. There is no abstract region in your brain. So how do you know that it's abstract? You know that this is an abstract. You know that this is an abstract painting. How do you know that this is an abstract painting? There is no region in your brain that deals with abstract. How do you know that it's abstract? You know that it's nothing else that you know. It's not portrait. It's not landscape. It's not still life. So it must be abstract. So that's what you see here. So abstract versus non-abstract, no brain activity. So that means that if it's something that is not this, and not this, it must be abstract. So that's interesting and that's beautiful. Apparently there is no reason for our brain to develop regions for abstract. There are no abstract things in the world. There are faces, there are trees, but no abstract. So, but still there are abstracts because our brain generates abstract things. So this is how we know it's abstract. That's nice. But that's what was not the question of Semir Zeki. The question was not whether you have different brain regions for portraits or for landscape. This is clear. The questions are the regions that responds specifically to your liking or disliking, to your personal preference of whether this is ugly or beautiful, beyond the category, beyond the particular category. And here is the finding, which is really amazing and very interesting, very controversial as well. Still, this is a finding, and this is the finding as follows. So, beyond the category, now correlating your personal preference for this particular picture, whether portrait or still life. Suppose you liked this picture, and somebody else did not like this picture, but he liked another picture. So if you like the picture, and you do what you felt as beautiful, and what you felt as ugly, one minus the other, you see a particular region, the medial orbitofrontal cortex, that is being lighted up. Okay? Very particularly. So for all of us, independent of your specific liking, whether you like abstract or Picasso or Mona Lisa or whatever, if you like it, then there is a particular region being lighted up. And when you don't like it, there is a particular other region, the motor cortex, that lights up. But let me point out two things, or several things. So first of all, this is a general phenomena. And again, it's not a matter of whether this is a particular category. It's a matter whether you like it or not. That's the issue. And so let me emphasize through this paper a few things. So whenever you see something that is either you like it or you feel it's ugly, both regions are activated. It's not that only this region is activated when you like it, and only the motor cortex is activated when you don't like it. Both regions are activated. But one is activated more than the other. So both engage the same areas, both ugliness and beautifulness engage the same region, but to different proportions. So changing the relative activity in the orbitofrontal cortex here, when it is more active than the other, so increase in the activity of this region, correlates with judgment of beauty. Okay, beauty is stronger than ugliness. So this region becomes strongly activated when you feel this is beautiful. But also the other region is active, but less. And vice versa for ugliness. So, okay, so changes in the relative activity of the motor cortex, so this now becomes more active. But this other region is also active, but less. So one is becoming more active, the other one becomes less active. Then it is correlated with ugliness. So this is interesting. There are these major regions that responds to your private feeling of ugliness or beautifulness, and both are active but to different proportions. So it's a continuum thing, this is more or this is less, this is a little bit less and this is a little bit more, or then it switches and this becomes more and this becomes less, so now it's ugly. So now it's beautiful, according to your personal preference. That's very interesting. One thing that is interesting, and that I think people would not probably maybe in advance predict, that when you feel that something is ugly, that the painting is ugly, that you don't like this painting, your motor cortex, which is usually used for movement, why is it active? One hypothesis, one possibility, is that this painting is aversive. You don't like this painting. You want to escape. You want to run. You want to run from the painting. Maybe you don't do it in the museum because you are polite, but your nervous system wants to escape. The motor system is active. It wants to move away from this ugly painting, aversive painting. Maybe you don't do it. So that's an interesting use of the functional MRI to read your brain, in some sense, to read your preferences. So even at that level, whether you like something or don't like something, after a lot of calibration and after knowing what you like and don't, and so on, you can see different regions that are commonly to all of us, non-expert in art. It's not that because you are expert it is lighted up. Just because you have a preference. Whether it depends on art or anything that you like or don't like, that's another issue. Is it an artistic aspect that you like art or not? Or is it liking something else as well? These are issues that I don't want to discuss now, but just to show you what can be done with this machine. How can I probe into your brain, looking not only whether you see faces or whether you see still life or whether you see a tree, but also whether you like what you see or whether you feel it's ugly. So this is really going into your brain to a limited degree. As I said, it's not particular face. It's not particular aspect of the world that you look at, but it is saying quite a lot about your brain. So this is very interesting. But I think the more interesting thing that one wants to look at is looking at a case where you cannot interact with the brain otherwise. So the person cannot talk to you at all. The locked-in syndrome. So you can use the same machine that I just mentioned, the same technology, the functional MRI, to interact with the brain in a vegetative state. There is a lot of interest now, especially recently in Israel. You may know that our previous prime minister is in a coma for, I think, more than 5 years now. Cannot interact with him in a direct way, you cannot speak, but you can maybe look at his brain and see whether his brain is conscious. Can it respond to things? So this is a very interesting paper headed by Martin Monti, a professor now in Berkeley, then in University College London, one of the leaders of the field of looking at the brain of locked-in person. That's the term, you are locked in, you cannot interact. Looking at the brain of these patients, asking whether they are conscious, can they respond consciously, do they understand, so to speak, something about the world. So this is using the same technology. By the way, the same person, Martin Monti, was recently, 2 months ago, visiting Israel and scanning the brain of Sharon, with yet unknown results, but some of them are really surprising. Not completed, but still. So what can you do? What can you do with this machine in this case? So some of these patients, not all of them, but some of these patients, including Sharon apparently, can respond willfully and specifically to a particular question in a particular, using particular brain region. So very briefly, what you try to do, what they try to do, the researcher, is to teach the person, the locked-in person, to teach him to respond, to activate willingly different brain regions depending on whether the question is, the answer to a question is correct or not. For example, You can ask, this is a patient now. You can ask the patient and scan his brain. Ask the patient, is your father's name Alexander? And you instruct the patient, you teach the patient to activate the motor region if it's yes, or another region if it's no. So you can teach the person to willingly image something, let's say image tennis playing, when the answer is yes, okay, or image something else. Let's say image a tree when it's no. So you image when it's yes, you use the motor cortex to convey the fact that this is yes. And when it's no, when the answer is no, you use a region in the brain that involves dealing with trees. So this is how you dichotomize the response. Yes, meaning that you will activate motor cortex. No, meaning that you will activate another region. So that's how I can interact with you. Because I can ask, is your father name Alexander? Let's say that it's yes. Then I should be able to see activity in the motor cortex. If your father is not Alexander, let's say something else, then you say no by activating another region. So I can start to interact with you. And this is amazing. You must admit that this is something really touching. Some of these people for years and years could not interact. You didn't even know whether they even realized something about what happens around. And suddenly you can see that some of this brain, not all of them, some are in a coma at a state where there are no interactions. And so the brain is in some sense dead. But this is a case, these patients you can see that very specifically, these patients can activate the motor system, the motor imagery system. So he image a motor movement and he activates this region. You can see the same control for a healthy person. So if I'm asking you now to close your eyes and think about tennis, this region will be activated, the motor region. So you see how similar the patient motor imagery and the control person, non-patient person, the imagery here are very similar. So this person is conscious and he can activate by will this region or this other region for spatial, for a scenery imagery. He image a forest. You see a normal patient, you see. So this is a new method, very recent, to interact with locked-in person. This is a fantastic tool. It raises a lot of ethical issues now that he is locked in. How do you interact with him? At what level? What to do with him? What about suffering? And all these other issues that are not beyond what I want to say, but just want to show you what can you do with these fantastic tools. It's a brain reading. You read the brain after teaching the brain how to respond and so on. This is beautiful. And this raises, and I want to finish with this aspect, the issue of brain polygraphs. So from what I told you, it sounds maybe that I can look at the brain and say things about the brain, which I can. By the way, I can use other techniques like EEG, electroencephalograms, or functional MRI, and other techniques that are not invasive, but still I can look at your brain. So, people are very afraid. Here I have a brain, I can look at your brain, I know all your secrets, I know all your thoughts, I know everything. Very frightening. Is it really frightening? Okay, is it really frightening? This is for future discussions, but I want only to say just to relax all of us from this frightening, because I already mentioned a few points for discussion. First of all, you want to ask what is the success rate of what I showed you before. I told you that there is this issue of calibrating per person unless you want to say something very general about is it faces that you deal with or is it a forest that you deal with. These are very general issues, and this we can look at your brain without much calibration. Still, you need to calibrate. Each brain has its own level of activity, and so you have to calibrate. You have to do a lot of things before you come to a conclusion. You have to average many responses because these machines are very noisy and the brain is very noisy, so you have to average again and again. Very rarely you can take one shot, one look, and say something about the brain. You have to average a lot of signals in order to see the average signal which should reflect something about your brain. So there is the issue of noise and variability. The brain is very variable, and there is the issue of personal variability. So each person has slightly different way or region, and if you want to go into the details of what you now process, you need to go to a personal level, which means that, as I said before, like polygraphs, you have to sit there enough time and lie and lie and lie and lie until you get a calibration for how your blood pressure and other parameters relate to you lying. And then you have to say the truth, the truth, the truth, the truth, and then you calibrate the machine for you. I calibrate the polygraph for you. And so I need to calibrate my brain polygraph for you if I need to read your brain. So this issue of calibration, personal calibration, is of course reducing the capability of the machine to say particular things about yourself. You have to cooperate, and it has to go enough times in order to calibrate. After calibration, you may say more specific things about yourself because I calibrated to your liking. When you look at a particular face of your wife, of your husband, then I can say something that now you are thinking about your husband, but I need to look at it a lot of times. So this is the issue. And the question eventually is, because you think that because I look at my brain, the source of everything, then I go directly to your thoughts. But apparently, at least today, the success rate of looking using brain polygraphs, if we want to call it this way, fMRI or EEG, looking at your brain directly at your brain, so to speak, with these techniques, and looking at a regular polygraph which is remote from your brain. It's your blood pressure, it's your other parameter, your finger pressure, and other aspects of measuring things from the periphery in the machine, can tell you about the same after calibration, after personal calibration, about the same as these machines. So it's not a big improvement. Because some of it is because the machine is crude. You look at the skull, you look at blood flow. It's not at the level of cells, of networks. But still, even if I could look at your cells and network, I would need to calibrate it personally because your spike here says something else than my spike here. It's a personal representation. So there is the issue of personality, individuality, that makes life, so to speak, difficult for these machines. So you should worry much, much less than in all the science fiction movies. They will look at your brain, they will read your brain, they will know exactly what you want to do. Exactly. This is not going to happen unless you give your brain, so to speak, enough times to the experimenter, then he study your brain, then he can say something more specific, including what letter you look now, what is the sentence that you look now at now just by looking at your brain. But this has to go through a lot of calibration and a lot of averaging again and again and again and again. So this is the state of things today in terms of using these technologies for brain reading. So I wanted to give you a basis for what can be done, and beautiful things could be done. For example, reading yes, no, binary, or maybe a little bit more for locked-in patients. It tells you a lot about if his brain is conscious or semi-conscious and so on, which is very important. But reading your thoughts to the level that know which person are you now thinking about, or what exactly is your plan for the next hour, and who are you going to meet, not with these machines.